I wanted to quickly answer this question. Can I have testosterone without estrogen HRT? Hello, I'm Dr. Nagat, and yes, I do have henna on my hands. It was Eid yesterday. We had a lot of family together. It was amazing. To answer this question, although there are studies that show that testosterone use alone does have some benefits in patients, in fact, to get the most benefits, it's better to use estrogen and testosterone together. Here's what's to consider. Basically, if you're using estrogen therapy, you're trying to treat all the menopausal symptoms such as brain fog, irritability, hot flushes, night sweats, palpitations, tinnitus. Also treat vaginal symptoms as well. And also in the menopausal phase, estrogen is really important for protection of your brain, bone health, heart health. The lowering of the estrogen can be related to the impact on your libido as well, particularly if you're having insomnia, sleepless nights, hot flushes, and vaginal atrophy type symptoms. So using estrogen alongside your testosterone therapy is really important, particularly if we're trying to deal with the symptoms of low libido. That's not to say that testosterone therapy as a gel or a cream, the only reason we use it is for libido. What the data also shows that if you're using testosterone therapy on its own, without testosterone therapy on its own in women has shown to have higher androgenic impacts, so such as acne, maybe loss of hair on the head and more growth on the face, or growth where you're putting the testosterone therapy. So really the androgenic side effects of testosterone are heightened or increased if you're using testosterone on its own. And you also make a really good point. The recent studies indicate that there's no increased risk of breast cancer in women who use testosterone therapy. We need to have far more data to back that up because we need to have a meta-analysis. And as you know, when it comes to testosterone therapy in women for menopausal symptom management, we are still so far behind, so we definitely do need more data. It's always going to be an individual basis of when you introduce testosterone therapy for the right patient at the right time as well. And it could be that in the future, as we understand more about the role of testosterone in menopausal, postmenopausal women, that for those that don't want to consider estrogen or can't have estrogen, then they might want to consider having testosterone therapy on its own. So watch this space. I think we've got far more information and data and research that's needed in this area, but this is a really good question.